Channel 2 and their giant mic flags.
Shit. I'm gonna have to take it off.
Yeah, you have to take it off. No choice. Sorry.
Yes, we've been, for 2 years now, really, we've been pretty heavily delivering Poloncarz. Is there a part of the country?
Yeah, I want to put this on first.
California is huge market. Their health and wellness. Yeah. In general.
I thought it was charming dispositional.
What? We're gonna, I think we have a clean stuff. It like clicked in there.
Yep.
There
you go.
And they were definitely
Yeah. That's the Buffalo Public.
As of right now, sometimes it changes.
So all of your, all of the outlying schools are already out there.
So Amherst, Tonawanda,
Whatever you feel comfortable.
This is good today.
Get everybody to start coming on behind. Once again, it's
You need me to move or anything, Monica? Am I good?
let me know when you're all set and we'll get going. Everyone ready? Kevin, you good? Okay. Good morning, everyone, and welcome to the Service Center for the Buffalo Public Schools, the Joseph F. Jones Service Center on Bailey Avenue, as we are here today to show the release to the school districts in Erie County of the first shipment of Austin Air cleaners that were purchased by Erie County through a federal grant so that every classroom in Erie County could have the highest, most effective air cleaner to ensure that our children are in a safe environment when they go to schools with regards to disease and issues associated with COVID-19. I'm joined here by Dr. Gale Burstein, the Commissioner of Health, as well as Nate Kuzma, the General Counsel from the Buffalo Public Schools, and Lauren McMillan, the President of Austin Air, based here in Buffalo. And I'm also joined, of course, by Karen Gambino, who is providing the American Sign Language interpretation for those that have hearing disabilities. So thank you, Karen, for being here. Earlier this year at my State of the County, I announced our Back on Track agenda to help students overcome the issues that they've had to deal with as they've gone from no school to virtual learning to being back in classrooms with masks and all the other things that they've had to deal with over these last 2 years. As we've seen, unfortunately, COVID-19 is probably here to stay. There is no doubt that the variants keep on coming, and with it, individuals keep on getting sick. And while I'm very glad to say that the individuals in our community who are getting sick are not as ill as they were before, primarily because of the amount of vaccinations we have in this community, there are still people who are suffering from serious illness and some who actually die from COVID-19. We do not want to go back to the old days in which school was held virtually. We want to be able to have our children in an in-school learning environment. We know that works best for them, and that's why we have to do everything possible to ensure that when they are in school, it's a safe environment for them so they do not have to worry about catching COVID-19 or other illnesses and diseases that often transmit airborne. That's why at my State of the County, we announced that Erie County would be purchasing from Austin Air more than 10,000 units to go into every classroom in Erie County, every public school, every charter school, and every private school. And I'm proud to announce that the first shipments to every public and charter school in Erie County are going out the door and have been received, just like what you see behind us here today for the Buffalo Public Schools. The private school shipments will happen this summer, so everything will be in place for the fall semester in the upcoming school year for the 2022-23 school year. But many of the districts have already put their Austin Air cleaners in the classrooms. The City of Buffalo just received their shipments, and they will be putting them in the classrooms very soon. And this is an example of what we can do to protect our public, to protect our most valuable resource in our community, our young. In fact, 10,600 air young. In fact, 10,600 air filtration systems have been ordered for every classroom in Erie County, and this was an investment of $5.3 million from a federal grant specifically to be used for COVID-19 mitigation purposes in school settings. We knew that there were various ways of spending that money, but the best way was to ensure that the classroom had the safest environment with regards to air filtration. A number of school districts across Erie County, actually all school districts across Erie County, invested in ways to protect their children. However, as we know, many of the schools themselves are very old, and they have older air filtration systems, and they could not utilize the latest technology. That's why we felt it was important to ensure that every classroom was treated the same, whether it's a school that just opened this year or one in which the building is more than 100 years old. We want to ensure that everyone is as safe as possible, and that's why we purchased these. And I want to thank, I think I just swallowed one of those things that's flying by. I want to thank our Department of Health for its great work, led by, of course, Dr. Burstein, who you'll hear from in a second. Austin Air for its availability to build these as quickly as possible so that they could get out across our community, and the school districts and all the leaders in the school districts for participating with us and working on this to make certain that those dollars that were allocated for mitigation efforts in schools were used for an appropriate purpose. With that, I'd like to turn it over to Dr. Burstein to talk more about this program.
Thank you. Thank you. So we are so excited to be able to partner with Austin Air to provide, state-of-the-art air filtration systems for all our schools to keep all our K through 12 students healthy throughout the year. And these air filtration systems will not only protect against COVID, they'll also protect against other respiratory pathogens that are circulating in the classroom. They'll protect against pollen particles that trigger asthma for many kids in the classroom. So this is cottonwood flying in the air, so nobody will swallow them inadvertently while answering a teacher's question. So this is really an evidence-based intervention. We know that this works. This is one of the programs that CDC highly recommends to protect against COVID. So we are so excited that we're going to be able to share this technology with a local company. We're with support through our county executive's office and our Department of Public Works, who researched these air filtration systems and found that we have the best system right here in our own backyard with Austin Air in the city of Buffalo. So we're very excited. So with that, I'm going to turn it over to Nate Kuzma from the General Counsel from the Buffalo City Schools. Thanks.
Thank you, Dr. Burstein. My name's Nate Kuzma, General Counsel, Chief Operation Officer for the Buffalo Public Schools. And I'm here today, good morning everybody, and on behalf of our 9-member Buffalo Board of Education, Superintendent Dr. Tanja Williams, and the Buffalo City School District, we want to thank Erie County County Executive Mark Poloncarz, the Erie County government, Dr. Burstein, and the Erie County Department of Health for providing, and Austin Air, for their ability to provide the Buffalo City School District with 2,557 air filtration systems that will go in each and every one of our classrooms as soon as this summer, and it will certainly be ready for the beginning of the 2022-2023 school year. These air filtration systems will not only help us continue to provide a safe and healthy learning environment for our students as another preventative measure against COVID-19, but as Dr. Burstein indicated, they also take out other pollutants in the air such as pollen, emissions from vehicles, bacteria, and the such. And they do a very, very efficient and good job in cleaning the air for our students to be educated in the safest possible environment that we can provide. And so we're very thankful to all of our partners for certainly thinking of us as part of this grant, utilizing these dollars for the benefit of our students, not only our students, but the other students that are educated in the city of Buffalo at charter and parochial schools and the other districts throughout Erie County. So thank you again, and we are elated, and our staff is eager to begin distributing these as soon as possible, beginning today. So thank you.
Thank you, Nate. Our partner in this process, of course, is Austin Air. We wanted to buy the air filtration systems, and then we also realized the premier manufacturer of the air filtration system is based right here in Buffalo. And that's why this is a double positive effect. Not only will it protect children in the schools, but also helps our local economy by supporting a local business, Austin Air. And we're pleased to have joined with us here today Lauren McMillan, the President and CEO of Austin Air, and the great work from her team to actually be able to construct these 10,000 plus air cleaners in such a short period of time, so that since we announced it just approximately a month or so ago, they're actually going to be distributed, as we see right now, in classrooms already. And that just goes to show the great team that she has there. Lauren?
Hello, everybody. Lauren McMillan, Austin Air Systems. We're very proud to partner with Erie County on this to get these to all of the students in all of the various school districts. We have been in business since 1990, so we've focused on clean air for a very long time. We're proud that these students will have not only for COVID, but RSV, and we have true medical grade HEPA and carbon, which takes all kinds of pollutants out of the air, improves cognition, improves test scores. So we're hoping that we can even get a little bit better test scores out of our local students. Thank you very much.
This is just one part of our Back on Track agenda. There's other portions which are actually being worked on, including the app to help with regards to parents identifying if there are mental health concerns associated with their children. That is a work in progress, but I'm very glad that we were able to deliver in a short period of time these air cleaners for every classroom in Erie County, and I'm not going to let one of those go in my mouth again. With that, we'll open it up to any questions on topic. Are there any questions on topic?
Just being geeky, I guess. How do they actually clean the air?
I'll turn that over to Lauren.
Sure. The true medical grade HEPA is certified to filter 99.97% of all particles that are larger than 0.3 microns and 99% of all particles that are greater than 0.1 microns. So basically, we have a 360-degree directional airflow intake and an output, an export that creates circulation within the air. So it circulates the air, pulls dirty air in through the bottom, and pushes clean air out the top.
How long are the filters good?
The filters are good for 5 years. That's something that is really great about the Austin Air product. It will last 5 years, no maintenance. You just replace it every 5 years.
Classrooms are different sizes. Are they, how large an area do they?
These are all rated for standard classroom sizes. We're going to increase the air changes at least 2 times per hour in each classroom. Anything else?
Okay. And if there are no further on-topic questions, I will take off-topic, and everyone else is free to run away at that point. Are there any off-topic?
Speaking of filtration, do you have any numbers on the latest COVID situation? Do you anticipate the level of status changing?
Well, I'll bring Dr. Burstein back. We have seen a reduction in the number of cases on a daily basis, including the positivity rate. The hospitalizations are still higher than we'd like them to be. Approximately 50% of all people who are in the hospital that are COVID-19 positive are there for COVID-19. Last I saw, and I know Kara Kane is looking at the numbers, I think we were around 12-13% for the positivity rate on a weekly basis. That's better than when we were. It's not where I'd want us to be. So there's still COVID in the community. Dr. Burstein, would you like to add anything?
Sure, thanks. Yeah, so as the county executive said, the good news is that our numbers are decreasing. Our proportion of positive tests are decreasing, our total numbers are decreasing. But again, you have to look at this in light as many people who really are infected with COVID-19 may not be testing, or they may be testing at home, and we never find out about that. However, we have been following the trends, and the trends are pretty strong and positive, showing that we are decreasing in numbers. Again, our hospitalizations are pretty stable, although more than 50% of people admitted to the hospital who are COVID-19 positive are not admitted for COVID-19. They're admitted for something else, like a heart attack or stroke or trauma or some other type of surgery. So this is all looking positive. However, we still have substantial numbers. I'm sure everybody here, all your viewers, know somebody who is currently infected with COVID-19. So we still have to practice good precautions, especially when we're indoors in crowded spaces. So the good news is we're getting better. However, we're still not there, but we anticipate, just like every summer, our numbers will come down. But we have to remember the fall is just around the corner, and we're anticipating in Erie County, the rest of New York State, and across the country, we're going to see very high numbers again. So COVID, as the county executive said, is not gone, and we still have to remember. And when the next boosters come up on board, hope people will take that. We hope later this month, when we're hoping that the FDA, ACIP will recommend the COVID-19 vaccines for children as young as 6 months of age, that parents will take their kids to get vaccinated and get protected from COVID-19. So these are all positive. So it's good news in general. Thanks.
We haven't hit summer yet, so let's just say fall's not just around the corner. It's not that far away, though.
There does seem to be a perception that it's over.
It's not over.
If I get sick, I'm just going to get sick for a little while and I'll be okay in a few days. So there is a popular perception this is over.
The perception that it's over is not correct. What we're seeing is less severe illness because of the amount of people that are vaccinated, but there are still individuals dying in our community, and based on the hospitalization rates we've seen, I wouldn't be surprised if someone died today, just because of how many people that we've witnessed in the past 2 to 3 weeks perishing, which is on average about 1 a day, I think. Yeah. So it's not over. If you are over the age of 65, you are vulnerable for serious illness, even if you have been vaccinated. Most people under the age of 65 that are vaccinated are protected. They may get sick. They may be a 2 or 3 day item, but I know some individuals who've had it in the last month, and they're still battling with it to a degree where they're still dealing with issues. Even if they're maybe back at work, they're exhausted, they have trouble breathing. I saw the soccer star Lionel Messi just announced he was having serious repercussions as a result of COVID-19 infection. So I think people just need to understand that COVID-19 is going to be here. I think we're stuck with it for the rest of our lives, and it's mutating. I don't know what the next variant's going to be. Dr. Burstein doesn't know what the next variant's going to be, but every time it mutates, it seems to become much more transmissible. I'm under the assumption that we are going to have to be getting COVID-19 shots for the rest of our lives, similar to getting a flu shot. You get a flu shot to protect yourself from the flu and also getting a serious illness with the flu. Well, I think we're going to probably be dealing with COVID-19 as an annual shot, or maybe a biannual one, probably for the rest of our lives, because it's here. And sad to say, it's probably still going to take more people as we go along. And if you haven't been vaccinated, you are highly at risk, especially if you are a senior citizen, because I know while we have seen mostly individuals over the age of 75 die in the last couple of months from COVID-19, they're not the only ones. And there have been some young people under the age of 50 and 40 that have perished just in the last month or so. So just be careful out there. It's not over.
The travel season, folks are going to other areas that might have higher incidences of COVID, and they're coming back to our area.
Well, our area is still one of the highest in the country. That's the thing we have to remember, is people like to travel, and that's great, but they're probably taking COVID-19 to other parts of the country because we're still one of the highest in the United States. And I just ask people to think about that. Get vaccinated. It's the #1 way of protecting yourself. Get vaccinated. I'm super boosted. I got the second booster. I said, fill me up. I'll be like Captain America with the super serum. I'm all set. That doesn't mean I couldn't catch it, but hopefully if I did, then I would be protected from serious illness, and everyone else should do the same. Any other questions?
Just the gas tax reduction, how are you going to monitor or enforce it?
The gas tax reduction went in effect today for both the county and state portions. We are capping our gas tax. We're collecting sales tax on the first $2 of any gallon of wholesale, and then after that we're not. We technically could have collected it for the full amount, whatever it was. The state has capped its amount as well. We sent our weights and measures staff that actually goes out and confirms the gallon that the place is selling is actually a gallon of gas. You see those stickers on every one of the gas pumps from our weights and measures. We sent them out the last couple weeks to various gas stations across Erie County to see what they were selling at, especially in the last few days. And now we want to see, are they reducing their price? If we see or hear of issues of price gouging, we will go after those retailers. So the retailers, if they're thinking, hey, I can give ourselves an extra 25-30 cents of profit, there's a reason why we got rid of the gas tax, or capped it, I should say. We didn't get rid of it. We capped it. It's so that the savings could be passed on to the consumer. If we believe that there is evidence that there's price gouging, we will work with our Consumer Protection Office and the Attorney General's office to go after those retailers.
What should people do if they think that they are doing that?
If they believe there's a problem, they should call our Office of Consumer Protection. I don't have the number off the top of my head. We can provide it to you, but our Office of Consumer Protection is the office that oversees those facets, including the Weights and Measures Division, and we want to ensure that what we did, which is capping the gas tax, is actually passed on to the consumer. Thanks, everyone. I think they have a model if you want to get a camera. On a dolly there.